Now, the global headlines bring back a sense of deja vu to me. Now, these are real media headlines. French president announces curfew for Paris, 8 other cities. The Netherlands imposes a partial lockdown. Northern Ireland imposes the strictest lockdown in the UK. Berlin has imposed its first curfew in 70 years. Italy is set to introduce new restrictions. London to go into strict lockdown, no indoor gatherings as of tonight. And this is troubling. More than half of France's nurses are close to burning out, according to a massive survey of nearly 60,000 French nurses. The global number has increased by 2 million since we last spoke on Friday, and there are all-time record highs of new daily cases. So we're adding about 1 million new cases every 3 days. So there are 44 countries in Europe with a population of 741 million, and they are now reporting more than 100,000 new cases a day, which is around about twice what the US is reporting. But given the population differences, they're currently experiencing similar incidence rates. The US has just reported its highest case since the 8th of August, and France reported a massive 30,000 cases yesterday. So here we are at 2 in Melbourne, and France is reporting 30,000. Some countries like the Czech Republic are reporting up to 20 times as many daily cases than during the first wave. Nepal, closer to home and where many of us have worked, is experiencing a major surge in cases, reaching 5,000 per day. And Myanmar, of course, of very special interest to Burnet, has now reported more than 30,000 cases, 765 deaths. Case fatality rate is similar to the global number, but that's a 9-fold increase in cases in 1 month. Now, don't forget PNG. They continue to report new cases, but they're on a very different scale to Myanmar, having reported 37 new cases in the past week. Now, you know I like graphs, and I think graphs can tell a story much better than I can put in words. So just a few glimpses. Czech Republic, you can see tiny first wave, massive second wave. Czech Republic is now building field hospitals because their existing hospitals are full. The Netherlands has an arrangement with Germany now where they are transferring new patients to German hospitals. United Kingdom has tier 3 restrictions in the north. And as I said, the Northern Ireland has closed just about everything and has a lockdown similar to what we've been experiencing in Melbourne. Russia really never got through their first wave like the US. So they never got below 5,000 cases a day, and now they're surging again to record highs. France, as we know, is one of the worst affected in Europe. Serbia is the only country I can find in those 44 European countries that appear to get through a second wave, through early lockdowns, but the situation is far from stable. Nepal, as I said, close to home, close to our hearts, is experiencing a massive surge. And Myanmar, you can hardly see the first wave in Myanmar. Now, I've been doing some research for the next global analysis update on island countries because there's been an impression that they are protected from COVID. Well, it's a very mixed picture. What is an island country? Well, the UN recognizes 58 what they call small island developing states and territories, 29 in the Caribbean, 20 in the Pacific, and 9 others. Now, some of them are high income countries like Singapore. They don't include a number of high income countries like Iceland, the UK. I'm going to leave the UK and Ireland out of this because they have such close links to continental Europe. Malta, Cyprus, Bahrain, Taiwan, and New Zealand. Australia is not considered to be an island nation. It's a continent, but we can consider it as one island country. And archipelagos like Japan, Indonesia, and the Philippines are also not considered. So island nations have the advantage when it comes to stopping travelers, importing disease, because seas are harder to cross than land, beaches are easier to police, there are no cross-border towns, and few people can sneak across the border. So these advantages, combined with strict quarantine, made island nations among the most successful at containing COVID-19. That, as you'll see, only really extended up till the middle of the year. So what countries are not affected at all? Well, these are about the only 10 countries in the world that have not reported a single case. I'm not counting North Korea. So there you have 10 of those countries. Although they've remained free of coronavirus, the economic costs have been high. So the ADB expects Vanuatu's GDP to drop by 10%, which is the biggest drop since independence in 1980. And you can see other expected declines in GDP. Moderately affected, well, Taiwan remains the gold standard, island or no island. They had experience with SARS and they acted very fast by blocking visitors first from China and then from the rest of the world. They did not impose lockdowns, but they had a very excellent test, trace and quarantine system. They have not reported a single local case since the 12th of April. It's 6 months. And they have a population similar to Australia. Mauritius, much smaller country, but also more or less implemented the same measures as Taiwan. And they have not had a local case for 6 months. New Zealand was one of the few countries to openly declare an elimination strategy. They strengthened contact tracing, isolation, stringent shutdowns and border controls. However, as you know, since early August, a new cluster emerged in Auckland with 292 additional cases, and authorities have not been able to trace its origin. Genomically, it does not resemble cases in the first wave, nor those cases in hotel quarantine. So which Pacific Islands have been affected? So far, 7. Now, the Solomon Islands has only had 1, and that was an imported case. But you can see the others include PNG, Fiji, French Polynesia, and Guam. So quite a number of overseas territories. Case fatality ratio has been low. During this last Pacific reporting period, you can see the variation, 1 in Solomon Islands, 2 in the Marianas, 24 in PNG, and a massive 961 in French Polynesia and 417 in Guam. And that's obviously due to their relationships with their colonial powers, if you can call it that. Severely affected, this is as far as I got in my research. I'll expand in the update, but here are some countries that have not fared well, particularly after July. So Cuba, Haiti, Dominican Republic, which has one of the highest incidence rates in the world, Jamaica, other Caribbean countries, the Maldives in the Indian Ocean, and a number of French territories, such as Guadeloupe, Martinique, and French Polynesia. So I'll finish with a few more graphs. Cuba, you can see a massive second wave, probably due to introductions from Central America and the Caribbean. Dominican Republic is actually improving, but you can see up to 2,000 cases a day. So they really had a massive outbreak. Jamaica, very small first wave, massive second wave. Maldives, very prolonged second wave. And Iceland, which was hailed as one of the best performers in the world, and you can see the numbers are very low, 90 per day, but that is due to the very small population of 300,000. So Icelanders are pretty disappointed. French Polynesia, I said, massive outbreak there. You can't see the first wave. So in summary, island countries had been relatively protected, including Australia, at least until July and August, but that advantage has diminished in all but a few states. Thank you.